value of health is known only if we fall ill. Good evening, dear friends. Welcome to BMC Global Live AlHilal Health World, nothing but lifestyle. Today we would be discussing about the healthy eyes, and the doctor joining us today is Dr. Dheeresh. He is an ophthalmologist from AlHilal Hospital, Salmabad, and he comes with an experience of more than 15 years. So, doctor, welcome to the show.
Good evening, good evening.
And thank you for joining us today.
Yeah, thank you for having me here.
So, doctor, let's start the discussion with the dry eyes. What are the causes of dry eyes?
Yeah, dry eye is basically defined as a decreased tear production in the eye. The tears are produced by a gland adjacent to the eye called the lacrimal glands. For some reasons, the gland is not producing sufficient amount of tears. This is basically dry eye. So, dry eye can be due to multiple reasons. Basically, as we age, the dry eye production, the tear production is a little bit less. So, it can produce dry eye. It can be without any specific reasons. It can be due to the change in the environmental conditions. We diagnose dry eye in the clinics by the simple clinical examination, or some may need a specific examination like a Schirmer's test or a tear breakup time test. So, the patients usually come with symptoms like he or she may say there is burning sensation, there is irritation, there is some foreign body has gone inside the eye, or even he can say I am not able to see properly. So, it depends upon the severity, the symptoms. So, if it's a mild, he may say I'm not able to focus on certain things, I'm not able to see properly, or if in the severe cases there will be redness, there will be watering, there is burning sensation. There are different types of dry eye. Dry eye can be decreased secretion of the middle part of the tears. The tears are divided into three parts, and it's called hyposecretory, and it can be evaporative dry eye also. So, we manage depending upon the case by case.
So, once diagnosed with dry eyes, what are the treatment options you go for?
Basically, the dry eye, we need to find out what exactly is the cause of the dry eye. If it is the environmental factors, we need to manage the environmental things. Maybe there is decreased humidity due to overuse of air conditioning. Maybe the patient is focusing on the computer, laptop, or using laptop for prolonged hours, that is causing the dry eye. So, depending upon the situation or the cause, we need to treat. The treatment is basically the lubricants or the artificial tears, and there are different types of tears in the market. We use these kind of tears to reduce the dry eye, and we will advise the patient to not to be on the computer, laptop for prolonged hours, or ask to wash the face a couple of times a day, not to overdo it also, because overdoing also causes problem. So, that cleanses the tears, and also it decreases the dry eye.
Now, can you explain about some procedure to avoid glasses in youngsters?
Glasses in youngsters, the people wear glasses for a variety of reasons. Usually they are for refractive reasons, maybe a myopic, maybe hypermetropic, but certain section of the community wants to get rid of the glasses at least temporarily or permanently. For a temporary solution, I will advise them to wear contact lenses, which can be a daily wear, it can be a monthly wear. So, people who want to use contact lenses for a single day, for a special function, or for a special occasion like going for a football match or something, they can use a contact lens. But contact lenses are temporary solutions. A little bit of care need to be taken, care need to be given for when you're wearing contact lenses. But a permanent solution will be going for LASIK. LASIK is a laser procedure which is done on the cornea depending upon the patient's refractive condition. So, it is like a 10 to 15 minute procedure. We do a flap on the cornea with the laser and apply laser on the stromal vein, altering the refractive condition of the patient, and that is more safe and a permanent procedure.
Is this an expensive procedure?
Well, it is not a very expensive procedure. Of course, it is more expensive than a contact lens, but it's a permanent solution. It's more safer, and very rarely you get any complications after undergoing laser. So, the term LASIK stands for laser in situ keratomileusis, and patient may get a dry eye, may get some slightly blurry vision, but the percentage of people coming with complaints are very less. So, relatively it is a very safe procedure.
Okay. Can we go for the same procedure for elders who use reading glasses?
Yes, we can do a modified procedure, not exactly a LASIK for people who are under the presbyopic age who want to get rid of the glasses for reading. We do have a procedure to get rid of the glasses for reading, for near work, near reading. Yeah.
So it's advisable for the elders also to do the same.
Yes, it
procedure.
is advisable. It is a safe procedure, but we do have a recommendation that a person who is working for doing a lot of near work, we don't recommend that for because this presbyopic LASIK is dependent upon the age. So as we age, this may not work very well. So person who is a business person, a business lady, is advisable, but not for a person who is keen or a office going person who need to do a lot of work, near work. This is not a very advisable.
Doctor, can you now explain about diabetes, the effect of diabetes on the eye health?
Yeah, the diabetes affects the eye in a different ways. Basically, the effect causing diabetic retinopathy, which is the effect of the diabetes, the disease diabetes on the sensitive tissue on the back part of the eye called the retina. So which we call the diabetic retinopathy. It can affect, diabetes can affect causing dry eye, can cause early cataract. So patient may come with you cataract in their 40s and 30s who's having diabetes for more than 10-15 years. And it can also causes occlusion of the vessels, the blood vessels on the retina, which we call retinal vein occlusion or retinal arterial occlusions. This is like getting a heart attack or a stroke in the eye. But most commonly what we see in the clinic is that the diabetic retinopathy patients, which can be classified into mild, moderate and severe depending upon the effect of the diabetes on the retina. So in the case of a mild diabetic retinopathy, we need to just observe the patient, ask them to control the diabetes very well, ask them to send to the general medicine, the internal medicine doctor to control the diabetes. If it is moderate to severe, we may need to give lasers, multiple episodes of lasers, or even medication through injection into the eye. We call intravitreal injections. But the basic thing is that we need to have a constant follow-up because this disease is progressive if not corrected at the particular stage, because the diabetes is not a curable disease.
Doctor, our viewers would like to know more about cataract. Can you explain it in detail?
Yes, the cataract is the opacification of the lens inside the eye. There is a lens inside there like a camera which focuses and produces the image on the back part of the retina. So the opacification is called cataract. Cataract can usually occurs as we physiologically change, as we age in advance. Maybe usually it manifests when you are in the 50s or 60s, but in certain cases it can be pre-senile. It can come, for example, a patient is having diabetes, uncontrolled diabetes, or some other debilitating disease in the body, the cataract can manifest much early. The patient may complain of blurry vision, he is not able to see properly, he is not able to focus, even not able to see in the bright light, maybe he is having glare while driving at night time. So all these are complaints patients come with. So the treatment of cataract is basically surgical. You need to remove the lens and replicate with an artificial lens. So the surgery is a half an hour procedure. It is under topical or a local anesthetic, and we do implant an artificial lens inside the eye. That's how we do the cataract surgery.
Okay. If we don't treat the cataract on time, is there a chance of the patient losing his vision?
Well, there will be a temporary loss of vision per se due to the cataract, because the cataract, as it matures, becomes opaque and the patient will not be able to see for near and distance. So patient will have complaints. But if there is no problem for the retina on the back part of the eye, no problem with the optic nerve, he can regain the vision once the cataract surgery is done. But I advise people to not to wait till the last stage, to the mature stage, because with the modern advances, he can do the cataract surgery and enjoy the beauty of the life and the sight much early.
So, doctor, now can you explain about glaucoma?
Yeah, glaucoma is a sight-threatening disease, which is basically due to an increase in eye pressure inside the eye. So I recommend people who are having glaucoma to have constant follow-up and to have a constant medication. We do see people not following medication because a glaucoma is a lifelong disease. You need to put the medication, you need to put the eye drops lifelong. So some people during the process may get bored or not able to comply with the medications, they may lose track also. So it is better to follow up with the doctor every 6 months or whatever the doctor is saying, and continue the medications, and the doctor will let you know, depending upon the scan, whether the glaucoma is progressive or is stable, and to maintain the vision, because once the vision lost due to glaucoma cannot be regained. So, but there are instances where we need to have a pre-checkup in case if there is a glaucoma tendency in the family, we need to undergo frequent checkups before the glaucoma. So, it's better to have a precaution than having the disease.
Now, doctor, do you have any advice for our viewers?
Well, once Helen Keller said, among all the senses, sight is the most beautiful. So I believe people should take care of the eye. People should, if there is any problem in the eye, they should follow up with the doctor and take the medications whichever is required. For example, as we said regarding diabetic retinopathy and glaucoma, all those are sight-threatening diseases. So this has to be taken care, and then take care of the dry eye also. People are focusing on computer, laptop, should have a micro breaks in between. I will say 15-20 minutes you're on the computer or laptop, you look straight, you relax your eye muscles, come back, take a small micro break, maybe 5 minutes break after 1 hour or something. So all this will help to preserve the vision till the end of our lives.
So, doctor, finally, what do you have to say about AlHilal Healthcare?
I'm available from 9 to 11 in the morning and 5 to 9 in the evening in Salmanad branch, but you can avail eye services in all of our branches.
Thank you, doctor.
Thank you so much for having me.
So, viewers, I hope this was a very informative episode. For more informative episodes, tune into BMC Global Live AlHilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.